Dr. John Catanzaro of UF Health Jacksonville.
Good morning. I want to thank JAX USA and UF Health for the honor to present today. A lot of the buzzwords that I've been hearing through this whole conference and symposium included complications, safety. I won't be using chainsaw, I promise. But I think part of the mission, as we'll discuss in a moment, is really looking at how to advance medicine. And what's very difficult to do is advance medicine in a way where safety and efficacy are both increased. You usually have to give. If something becomes safer, it usually becomes less efficacious. So with that, let me figure out how to use this remote, and we'll talk about a window into maximizing safety and efficacy and advances in medical device technology. So at UF Health, who are we? So we are on 8th Street. Our mission is to heal, to comfort, to educate, and to also discover, eliminating healthcare disparities through research and innovation. And I think research and innovation are an investment like anything else. If you're not innovating, then you're just doing what everyone else is doing. Doing something different and innovating gives you the opportunity to take that next step, to do something different and to scale where no one has gone before. So when we talk about innovation, my favorite type is disruption and disruptive innovation. Now, when I think of the word disruption, it has a negative connotation. I think of my mother-in-law visiting me from New York City unannounced, and that really comes to mind. But then, after going to business school and looking into disruption a little bit deeper, when you're making a radical change in an industry, and in the medical industry, it becomes positive. It becomes something that you're not saying you did the 500th procedure, you're saying you did the first, and you're leading the way as a first mover for others to follow. We look at two big markets. I know you've heard about atrial fibrillation. I'm an electrician of the heart. You've met the structural heart or the architect, and they're also our plumbers. But part of what I do is take care of the most common arrhythmia with a prevalence in the millions, and also put in defibrillators and pacemakers, which are life-saving therapy. And if we look at these total addressable markets, they're gigantic. I mean, we're talking about a $23 billion industry, including Medtronic, Boston Scientific, Biotronic, and Abbott now, which was formerly St. Jude. So this is clearly an area that is heavily funded and heavily funded in innovation. Now, part of understanding what's going on, as Albert Einstein is frequently quoted, if you had an hour to think about finding a solution, you'd spend 55 minutes thinking about the problem and 5 minutes thinking about the solution. So part of my journey through UF over the last 7 years was trying to do something different and performing procedures, which everyone routinely performed, but then looking at pain points and trying to find out how to solve problems that have been around for 20 years. And you can see here a picture. On your left is the heart, and the area that we work in is the atrium, which is the red top chamber on your right. And there are 4 veins in that atrium where we work around, and we cauterize signals from taking signals that belong in that pulmonary vein and keeping them there by using either radiofrequency energy, which causes heat, or cryotherapy ablation, which is used by a balloon, which causes cooling. Now, as you can imagine, the standard of care is really just to measure temperature. So there is collateral damage, and this is where the safety comes in. And there's your esophagus, which is right next to it. And if we look at your esophagus and where the work is being done, there's a distance of 2 to 3 millimeters. So the esophagus can really take up a lot of the excess heat and or a lot of the excess cold to temperatures around negative 20 degrees or temperatures around 40 degrees Celsius. So part of the problem here is understanding how to come to the next step. So with the standard of care, we use a temperature probe, which sits in there, and if it ever goes off, it makes a loud beeping sound, and we stop applying energy, whether it's cryo or whether it's radio frequency. But we're not done there, because the temperature either keeps going up or keeps going down. It's almost like putting a piece of steak in the oven. When you remove the steak, it still cooks as you remove the steak. So with that being said, I said to myself, can we do something to modify this? Can we do something to actually put something in the esophagus to actually change phase and absorb some of the heat and or cold and transfer it in a different way. And we were successfully able to start from a napkin drawing, come up with a prototype within a year and a half, and have it internationally patented. And I'm proud to say we're going to start at least the first in man in the next year or two clinical trials with this device. But part of it is proprietary, and that's why we just see the heart here. Moving on, we look at defibrillators and pacemakers. So there's a huge infection problem. There's also a huge interference problem. So I'm not sure how many of you are from Detroit, but there was an article about 8 months ago that came out that said, don't put your iPhone near your defibrillator. So it freaked everybody out. The FDA came in, and I saw the report, and I'm like, wow, this is really scary. So what happens is the iPhone 12 has a MagSafe technology, where if you put it in your pocket, which happens to be apparently where 90% of defibrillators are implanted, it deactivates therapy. So if a patient goes into a cardiac arrest, it won't save them. And you know, Apple really didn't do anything but put out a statement saying keep your iPhone 6 inches away or 1 foot away when charging wirelessly. So I said to myself, here's a problem. Let's come up with a solution. So the solution was actually to find a novel material to do the same thing, napkin drawing, intellectual property, secure the intellectual property, and then sort of innovate that into a wearable and embed it into not only a phone case, but also some type of t-shirt or garment that you're able to wear. So patients can be confident that if they're sitting around a room with people with iPhones, they don't want to run out of the room because they're scared. So we have to really be sensitive to the patient themselves, but at the same time, we have to really embrace innovation and technology. And I'm happy to say that we're working on a grant from the National Science Foundation with Under Armour as a potential commercialization partner. So finally, I mentioned, volume is not everything. I think doing things first is exciting, it's fun, and I was blessed to put in the world's first regenerative envelope around a pacemaker and a defibrillator. So essentially, infection is thought to come from when the incision is made from the battery change of the defibrillator at the time of the surgery. Bacteria and or bugs, so to speak, are let out or released. With this pouch, once it makes contact with the tissue around the pacemaker, it programs the cells to actually regenerate into cells that grow into blood vessels and have oxygen and make a more healthier environment for the defibrillator. So before I end, I'll just leave with a brief story. I have an 11-year-old son named Anthony, and when we had the hurricane, I believe 5 years ago, we were living in an apartment, and I brought him to work because I had to grab a magazine from my office. And on my desk, I have all these prototypes. And he said, Dad, are these all the pacemakers and defibrillators that everybody's putting in? I said, Anthony, no. I said, these may be one of the first that may be put in the future. So always think big, and at the same time, I'm really proud to be here, and thank you.